The first patient that I'm giving a report on is CW in room 1. Her birthday is 5/5/2008. She's 10 years old, admitted 2 days ago with DKA and diagnosed with type 1 diabetes. Her doctor is Dr. Kim Shin. She weighs 33 kilograms, no allergies, no isolation precautions. Her vital signs, temperature was 36.5 degrees Celsius, heart rate was 88, respiration's 20, blood pressure 114/76, 99% oxygen on room air, and no pain. Intake and output, 480 milliliters by mouth intake. Output was 500 milliliters urine and 1 stool occurrence. Her diet is 1600 ADA. IV access, 0.9% NaCl IV continuous 50 milliliters an hour. Her neuro is within normal limits, HENT within normal limits, cardiovascular within normal limits, respiratory within normal limits, GI/GU within normal limits, and musculoskeletal and skin within normal limits. Her dad brought her in because she was dizzy, vomiting, and out of it. Her blood glucose was 500. She was showing signs of DKA, which brought to her diagnosis of type 1 diabetes. She stated that she had nocturia, polydipsia for about 10 days and felt nauseated, and she also experienced weight loss over the past few weeks. She had a complete metabolic panel, QAM, complete blood panel, QAM, hemoglobin A1C on admission, C-peptide on admission, urinalysis on admission, and a urine ketone dipstick, QAM. Her current orders are vital signs every 8 hours, and POC, finger stick, blood glucose, ACHS. Her meds are insulin glargine, 5 units HS, and insulin lispro sliding scale, and administer that AC. Her parents are divorced, and she stays with each of them for 2 weeks at a time, and her dad is present with her today. They are both very new to diabetes. There's no family history other than her paternal grandmother having type 2 diabetes. She does have an appointment with an endocrinologist coming up. I used to teach back method for insulin administration. She did well with that. And as far as her lifestyle, she says that her mom cooks healthy food and her dad does his best, so maybe some teaching on healthier eating. She likes to eat rice, pasta, and chicken. For exercise, she said she likes to ride horses. I recommend that we do further education and support on her lifestyle management and diet, especially since she's back and forth between the households and school, learning how to manage this new diagnosis and moving between homes through all of this. And maybe a support group would be helpful to that, and some handouts on education for diet and exercise. Otherwise, she's ready to go home. And the second patient we have is a post-op appendectomy patient. I have an 11-year-old S in room 2. He is post-op day 1 from an appendectomy. His doctor is Dr. Smith. He weighs 64 pounds, no allergies, oriented ×3. Vital signs, respiratory rate was 24, oxygen 94%. We did coughing and deep breathing with splinted it, and it brought his oxygen back up to 98. His pain was a 7 when he's moving. He had diminished breath sounds in his lower lobes during this time as well, which improved afterwards. A focus assessment was within normal limits. He has an incision in his lower right quadrant about 2 inches long with 4 steri strips and a 4x4 gauze with dermabond on it. There's no drainage or pain upon palpation. His bowels were hypoactive ×4 quadrants, and pedal pulses were 2+. Meds, ampicillin 50 milligrams per kilograms a day for 48 hours, to be given every 6 hours, and 100 mils normal saline running over 30 minutes. Today, Sasha was in a lot more pain than yesterday. I gave him morphine and diphenhydramate around 1200. He is resting now and rests better when he has items from home, such as a book or listening to music on his iPod or watching TV. I recommend that he tries to get up and walk today so that he can be discharged. No shower for 24 hours after surgery, no swimming 1 week after surgery, no PE or gym class for 2 weeks after surgery, no contact sports or lifting greater than 15 pounds for 4 weeks. He can resume a normal diet. Scheduled over-the-counter ibuprofen for 48 hours. Alternate that with acetaminophen every 3 hours. and his prescription medications are oxycodone elixir only if needed, and we need to remind him to stay on an over-the-counter stool softener if he's taking narcotics. Otherwise, he is doing well, and our goal today is pain management.